I will be talking about the cataract, which is one of the commonest diseases in the eye. Cataract is basically an opacity in the lens, which is a God-gifted lens, and that causes a decreased vision. It is normally occurs in the age-related patients, but it has also been recently seen in the younger age population due to the stressful life. When the vision goes down, the patient needs to undergo a surgery. That is the only line of treatment which any eye doctor can offer in any part of the world. The surgery, nowadays what we are doing is the latest technique where we do a phacoemulsification with a very small incision of 2.8 millimeters, and then we put a foldable lens implant. These implants normally don't contain any reading number, therefore the patient needs to be supplemented with the glasses number for reading after the cataract surgery has done, that is 15 days later. The distance vision is normally the glasses are not required unless there is a small surgical number which is induced. We also have multifocal lenses which are available, which contain the distance and the near vision power, where the spectacles are not really required by the patient unless the patient is very specific about reading very fine prints or wanting to read far off distances. In the olden days, the doctors used to wait for the maturity of the cataract, but in the new era we don't have to wait for the maturity of the cataract because of the new techniques. The moment the patient is uncomfortable in his day-to-day life of decreased vision or having glare from the sunlight or from driving in the night or sitting in the car or sitting in the room where the light is causing a problem, he should contact the eye doctor and then go ahead with the surgery. Cataract can also happen because of the diabetes, trauma, or due to any kind of ultraviolet radiation directly to the eyes. Phacoemulsification is a stitchless surgery which is being conducted at our institute, Mohan Institute in Bensups Hospital. The surgery is normally a micro-incision cataract surgery where we remove the lens, the God-gifted lens, and it is implanted with an artificial lens, that is the foldable lens implant. The time taken is just about 5 to 10 minutes for the actual surgery, and the patient goes back home within a couple of hours. There is no general anesthesia for this surgery. The surgeries are mostly done under topical anesthesia, that is just with the anesthetic drops, or we sometimes anesthetize the eye with the block. Once the patient goes back after the cataract surgery is done, there are very minimal precautions which are required to be taken by the patient. There is no splashing of the water or rubbing of the eyes, and to use only tissue paper to clean the eyes. Apart from that, the patient can move around in the house or outside the house, can travel by any modes of transport. In summarizing, that the patient basically can do everything whatever he wants to do after the cataract surgery, and needs to follow up with the eye doctor, and also needs to be on some topical medications for about 6 weeks. Thank you.